Good afternoon. Welcome to all our Facebook fans. I'm Kim Wharton, the Communications Director for AARP Delaware, and we're about to have a lunchtime conversation on COVID updates for Newcastle County, including the vaccine information you've been looking for. We're going to start in a few seconds. Okay, welcome to all of our AARP Delaware Facebook fans. Thanks for joining us for this lunchtime conversation. I'm Kim Wharton, AARP Delaware's Director of Communications. AARP Delaware is having a lunchtime chat today with Newcastle County Executive Matt Meyer and EMS Chief Logeman. We're going to provide you with updates on COVID-19 and vaccinations. Both Chief Logeman and Executive Matt Meyer are hard at work giving Newcastle County residents access to vaccines. And we're tracking and working to contain the spread of COVID-19 in the county. Okay. Here in Delaware, a total of 254 administered doses of the COVID-19 vaccine have been reported to the state's immunization information system, the DelVax. You may have heard that term. A total of 279 doses have been delivered to the state, and 53,000 doses have been delivered as part of the federal pharmacy program. The state received 8,000 doses of the newer Johnson & Johnson vaccine. We know that Delawareans and Newcastle County residents have some concerns about COVID and the vaccine distribution. So if you have any concerns, we can try to address some of your questions and concerns today. We encourage listeners and viewers to this live event to add your questions and comments in the chat area below the video, and we will try to respond at the end or throughout. And also, we can put a response on Facebook after this event is over later today and try to answer all the questions that are in the chat. So let's talk about this COVID-19 and vaccinations with Executive Meyer and Chief Logeman. Hello to both of you.
Afternoon.
Good afternoon.
Great. So let's just start by, can you get Executive Meyer and then Chief Logeman, can you give us the latest update on vaccinations in the county?
Well, first, Kim, to you and Lucretia and Carlos and the whole team at AARP Delaware, I just want to say thank you on behalf of those of us in county government and also the people of this county and this state. The work that you do every day is vitally important, and particularly during COVID-19, we know that your membership has been particularly adversely affected during this time. Many of them, too many of them, homebound now for a year. And we really appreciate the absolutely vital work that you have been doing, and Lucretia and the whole team at AARP, to keep people safe and keep people not only physically healthy, but mentally and emotionally healthy during this critical time. So thank you. I'm honored to be here with Chief Logeman. As you may not know, Chief Logeman runs the Newcastle County Paramedics, the largest paramedic force in our state. They've really been on the front lines throughout this pandemic with standard emergency responses, going into homes and businesses and working with people who the paramedic doesn't know often whether that person is COVID positive or not, and puts themselves and their family at tremendous risk. So thank you so much, Chief Logeman, and also the tremendous work. I know many of you have been to our Newcastle County test sites and out to vaccine sites. The paramedics, once again, are on the front lines of those efforts, the hidden heroes of our county. So thank you so much, Chief Logeman, for being here. I don't know if there's anything you want to add. I can talk a little bit about vaccine, or Chief Logeman, why don't you talk a little bit?
Thanks for the nice words, Executive Meyer, and Kim, thank you very much, echoing what the county executive said to you and your team, because one thing I've learned throughout this entire past year is that communications with the public is extremely important. There are so many sources for information out there on the internet and social media, and a lot of what you read is good, solid information, but there's a lot of misleading information out there. So I really appreciate you having us on today and making sure some very good information gets out to your membership.
Terrific. So, well, let me ask you this. Have you seen any accessibility issues, both for the general population in Newcastle County, but also, it appears that it's all over the news that some multicultural communities are not receiving the vaccine at the same level that other communities are. So do you feel that residents have good access to the vaccine? And, what can people do to make sure they have good access to the vaccine?
So, Kim, that's a great question. First of all, I hope that many of you listening today have already had the opportunity to get one or more doses already. If you're either in Group 1A, a frontline healthcare worker like our paramedics, or in 1B, 65 or older, or now an educator, or if you're like my parents, you're hopefully breathing a sigh of relief. It's been such a challenging year for everyone, most especially the seniors and our most vulnerable populations, giving the what we know now, the increased risk of serious illness for those older and with specific underlying conditions. And it's really important that we continue to be vigilant as more of our population gets vaccinated. So even if you've already been vaccinated, let's follow very closely to the State Division of Public Health and CDC guidance. We're not out of the woods yet. There's always a chance of an additional recurrence, but we're optimistic. I think all of us are now about vaccine access, about the now proven effectiveness of the vaccine, and also about improving economic conditions. In terms of your question, Kim, about disparate impacts and the vaccine getting to the right areas, and has there been sufficient supply of vaccine to certain areas, I think the simple answer is no. I think the president, President Biden, former county councilman, Newcastle County Councilman Biden would say no. And I think Governor Carney would say no. We've been dealing with supply constraints since day one. And that puts certainly the governor and the president in a very, very challenging place. And sometimes medical doctors, when they have one dose or a limited number of doses, and they have to choose between, a 90-year-old, an 80-year-old with all these underlying health conditions, and a teacher or a principal who wants to open their school. Those are not easy decisions. I think the good news is we're getting out of this. It looks like by the end of the month, we're going to have the overwhelming majority of seniors who want the vaccine vaccinated. We're going to have the overwhelming majority of educators vaccinated, and we can do more to open it up to the general public. The one comforting note, based on what we're hearing from the various manufacturers, Pfizer, Moderna, Johnson & Johnson, who have all EUAs, FDA approved vaccines, what we're hearing from the federal government is that these supply constraints are going away. And what Chief Logeman and I are preparing for now, in partnership with the Division of Public Health, is participating in the mass vaccination, the mass availability of vaccination. So I know everybody's very concerned now that I'm not, I'm too far back in the line. I shouldn't be. I should be there. I should be here. What we're working on is making sure that hopefully within several weeks, when the vaccination is widely available, we have the systems, the logistics systems to get enough vaccine to sites, enough nurses, doctors, paramedics, data entry people, traffic, police officers, to make sure we can get everyone who wants a vaccine vaccinated safely within a matter of weeks, or more realistically, as the president said, within a few months.
Oh, that's excellent. Thank you for that update. And I do want to mention that AARP has all the vaccine information you need for the state of Delaware at aarp.org/DE vaccine. You can see it on the screen. And also, how about the spread of COVID? Let's pivot a little bit to the spread of COVID in Newcastle County. We know that there has been one case identified of this South African variant in Delaware. Are there any new measures in place to address the spread of COVID with this new strain or variants that people are concerned about?
Well, Kim, I can tell you that certainly the variants are a concern. There's very little known right now about whether the Pfizer, the Moderna, the Johnson and Johnson vaccine are going to be highly effective with variants. But the most important thing for us to do is prevent spread, period, whether it is a variant or not. And many people, if you go and you test for COVID and you test positive, that test doesn't tell you if it's the standard virus or a variant. So it's just extremely important that everybody continues to maintain wearing masks, social distancing, avoiding large gatherings, really keeping with the CDC guidelines. And I can tell you that's what I'm practicing personally. That's what I'm telling all of our employees who have been vaccinated. Yes, we've been vaccinated, but it's still our responsibility to wear the masks and continue to follow the guidelines. Because if everybody does that, and I think we've shown that up to now, where we're starting to see that we're getting a good grasp on the spread. But if everybody continues to maintain that, vaccinated, not vaccinated, while we, as the county executive said, are really gearing up here to vaccinate massive numbers of Delawareans, that's how we're going to get a hold of this, and that's truly how we're going to prevent the spread of these variants.
Excellent. And while I have you here, if someone does need to call EMS for an emergency or some other concern, how can they protect the EMS staff and themselves? Any tips on that?
Absolutely. So when you call 911, I ask that you be frank with the call takers. You tell them exactly what's going on. If you are COVID positive, have no fears about telling them that. At the beginning of the pandemic, and I think still up to now, we do experience some people who I believe are hesitant to say, yes, I know I'm COVID positive, because they're concerned that perhaps the level of care that they'll receive will be different, or not as many people will be responding to them. But regardless of whether you're COVID positive or not, we will be coming and giving you the same level of care. We have an excellent supply of personal protective equipment, and we have great guidelines in place to protect all of our providers and to protect the patients that we come in contact with. And letting us know through the 911 center when you do call 911 that you are COVID positive is a great benefit to everybody. We can ensure that we have all the proper precautions in place before coming into your home and getting you to the care you need.
Great. That's excellent. That's terrific. I know that Executive Meyer has a really innovative project that we've read about in the News Journal and some other media around the state. And we know that you've been doing some interesting work where you're testing sewer water around the county as a way to see where the viruses are concentrated or located. Matt, would you like to talk about that a little bit?
Sure. Thanks, Kim. If we think back a year and a day ago, we had our first case in Delaware, in Newark, a professor at the University of Delaware. And there was a degree of panic that set off, I think, across our community, including in my own family, where nobody was really sure what that meant. And for weeks, you may recall, there was so much uncertainty about who had this virus in their body, where the concentrations were, where the outbreaks were. And so it was really important that we found some way to identify this invisible enemy. The first way people were using was testing. And we still do use, obviously, testing through our award-winning Newcastle County testing sites and sites across the state, now at pharmacies and doctors' offices. Of course, you can get tested. The problem with testing is that often you don't go get a test until you feel some symptoms, or days or weeks after an exposure, you learn about it. So there's a delay. We've also learned that you can identify viral loads through our sewer system, through stool. So we've been measuring, going back to June of last year, we've been measuring through the sewer system, not only how much virus there is coming through our sewers, but how much there is in certain areas. So, for example, now at University of Delaware dormitories, we're working to identify so that it's an early detection of an outbreak, so that you can imagine if we notice there's a lot of viral load coming through, COVID viral load coming through a certain dormitory, we know that we need to now go and test everyone in that dormitory to keep them safe. You can, if you're wondering about what this sewer data is showing in your community, I encourage you to go to newcastlede.gov/sewer, CEWER. We're doing this in partnership with Professor Kali Keneal at the University of Delaware, the Center for Environmental and Wastewater Epidemiological Research, which is sewer, CEWER. I hope somebody from my staff can post that in the Facebook chat, newcastlede.gov/sewer. Rachel Maddow of MSNBC recently used it, used Newcastle County sewers to show how you can use this technique to get an early identifier of where COVID is in our community. And I'm advocating strongly, I think this should be done nationwide as an early detection mechanism, not just for COVID-19, but for other potentially dangerous viruses, for opioids in our community, and other things that pass through our sewer system.
Oh, that's really fantastic. Very, very interesting work. And I'm sure that'll catch on maybe even nationwide. And, we can be recognized for doing that. Let me just remind everybody that, we can take questions in the chat on this Facebook feed or address any comments you have. Have you had a good experience getting the vaccine? Is it easy? Is it difficult? Did you call the phone line? Did you go online? Let us know what you think. And here's your chance to get a response right from our County Executive, Matt Meyer, and our EMS Chief Logoman, who is helping to administer the vaccine statewide.
Kim, can I tell you something I read online the other day about the vaccine?
Yes.
That somebody went to get a vaccine, and when they left, they were having trouble seeing. Chief Logoman, I didn't tell you this. They were having trouble driving home. They were having visibility issues. So they got home and they called the place where they got the vaccine, and they said, "Yeah, when you left, you took the nurse's glasses. You didn't take your glasses. So you got to come and exchange your glasses."
Well, that's some good comic relief. That's great. Oh my goodness! Wow.
So it just goes to show. I think everybody's on alert. It's a new technology. It's a new vaccine. But and I was weary as well, to be completely honest. I think anybody who's thinking critically says, "Wait a minute, they developed this thing faster than ever before." But as my grandma used to say when she made me dessert, the proof is in that pudding. And it looks like so far the vaccine is performing extraordinarily well, both in terms of just about very, very limited side effects, and also just its effectiveness in keeping people out of the hospital and keeping us all safe.
Yeah, I think so. And I think when we compare Delaware to other states, there are degrees of success with the logistics of getting this vaccine into people's arms. Some states have done better than others. And I think we really would love to take the pulse of Delawareans to see, how they feel about this process. Feedback is the best way to make things better, or just tell people what they're doing is working. We do have a question that came into the chat. Somebody wants to know how can they be sure their registration online went through? They didn't get any kind of confirmation. Do you have any thoughts about that?
Yeah, so all vaccination right now, the state vaccinations is run through the Division of Public Health. I encourage you to send an email with that question to vaccine, VACCINE, vaccine@delaware.gov, vaccine@delaware.gov. If they're not responsive or don't get you what you need, don't hesitate to contact my office, and we'll do what we can to get you what you need. But that seems strange if you didn't get any confirmation. But I don't know. I haven't registered for a vaccine yet myself. My group hasn't come up, so I'm not sure what the registration process is. The details of that.
Great. Well, how about this for people who may have logged on, a little further into this broadcast? Let's go back and talk about how can you get this vaccine? Right now, I know we're in 1B, which is a group that's people over 65 and some people with different health conditions. So how can those people, keep registering and try to get the vaccine? And then also, when will the general population be able to just get the vaccine? I mean, when will they be able to go and get the vaccine?
So all of these, the supply and the decisions are being made first at the federal government and then at the state government. And like you, we learn about a lot of these things through the governor's press conferences and occasionally through conversations we have with the governor or the state Department of Health and Human Services or the Division of Public Health. The simple answer is that right now, there are many more people in Group 1B than there is vaccine, and there is the state's ability to get this vaccine into people's arms. The state is working very hard with groups like Newcastle County to increase that capacity, that ability that once the vaccine doses come, we can get them into people's arms. And all indications we're getting from the federal government is that that supply is increasing dramatically. So my expectation is within a matter of weeks, nearly everyone who wants a vaccine will be able to schedule an appointment for a vaccine. But it's going to take a lot of work. It's not just a matter of the vaccine getting produced and sent to Delaware. Of course, it's saying, how do you vaccinate 200,000, 300,000 people when the state in my lifetime and any of your lifetimes has never really had to do anything like this before?
It certainly is unprecedented. You know, I did want to bring up another interesting issue. AARP has a fraud hotline, and we have been getting calls really nationwide, and I'm sure it's happening in Delaware. If any of you listeners have heard about this, chime in on the chat, that people are calling and saying that they can get you preferential treatment in the vaccine line, or they can get you VIP status to the front of the line, but, oh, we need your Medicare number, or you have to pay us and we'll do that for you. It's really a scam. And so I wanted to make people well aware of that. And I'm just wondering if you have any advice for people if they hear something like that. You know, I mean, I know we're all excited, but
yeah, just if you have any question or concern, vaccines are free. They're free. If anyone's asking you for a credit card number, for a bank account number, anything, even in many cases, we can get you transportation to a vaccine site. If anybody's asking, trying to charge you anything for a vaccine, don't do it. If you have any uncertainty, talk to a family member. Of course, contact the AARP's fraud hotline. Even if you're not sure, you never can be a fool on this one. I like to say there are no dumb questions. If you have any concern whatsoever, please ask someone. It's better you get a little chuckle out of it than you end up out a lot of money or end up put in a bad situation.
That's terrific. That's terrific advice. Don't be afraid to ask somebody, does this sound right? Does this look right? And I do think that, there is a question coming in about people who are homebound. You did mention that you can provide transportation for people who need it. What about people who are truly homebound? What's the status of getting them a vaccine?
So there are some systems being developed. Again, keep in mind that this is all, as we like to say, we're building an airplane midair. The State Division of Public Health is calling the shots, and they tell us how we can help. So we're very eager, standing by at the ready, doing what we can to get vaccine to people. So that's certainly an issue that needs to be taken care of. The good, not to say that someone homebound is less of a priority, but the good news is, of course, if you're homebound, you're probably at lower risk, because if you're not out, going outside, interacting with new groups of people, the chances that you'll get the virus is lower.
Okay, well, that's terrific. And, in our long-term care facilities, things are opening up for visitors, and a lot of those people have been vaccinated. So we're thankful for that. I want to thank both of you for joining us today. Chief Logeman, do you have any final words for our viewers? Any words of encouragement or advice?
Well, certainly words of encouragement that we're seeing a downward trend in cases, which is great. With the vaccine, there's some people that are hesitant to get it, and as the county executive spoke to earlier, this is brand new technology. People are worried. My advice is, if you do have concern, you can speak with your family physician. But truly, the vaccine is what's going to really get us out of this situation that we're in. Mild side effects, I've personally experienced it. However, I don't think you can really beat the peace of mind knowing that you've received vaccine and you've built some immunity, and the knowledge that in the near future, maybe we can all start getting back to our normal lives of seeing friends and family again. So truly, I just encourage everyone, if you have the opportunity, get vaccinated.
That's wonderful. That's wonderful to hear. Executive Matt Meyer, any closing words for our viewing audience?
Thanks so much, Kim and Lucretia, Carlos, AARP, for the tremendous work you're doing every day, including these educational online videos. The great Chief Logaman and his team, the people of this county really owe a debt of gratitude to the paramedics. Every day of this crisis, they've been getting up on the front lines, putting themselves in harm's way. The only last word, similar to Chief Logaman, is we are so close to being out of this. The only thing I believe that can keep us out of this, keep us from getting out of it, is our own attitudes, our own stubbornness, our own desire to go to restaurants and movies and ball games a little bit too early. If we can we've done this for a year. I know for a lot of people, it's been worse than awful. We're so close to the finish line. Let's not give up now. A few more months of this, and I think we'll be in a much better place.
Oh, that's wonderful advice. And you know what? I think patience is a virtue, and we all need to tap into that right now and just try to give it another couple months. Thank you so much for joining AARP today, the both of you. And really, we appreciate the great work you're doing around the county to prevent the spread of COVID and get everybody vaccinated. Thank you so much. Everybody, have a great day.